Hello everyone, welcome to my channel. Please remember to like and share my content. If you have not yet subscribed, please subscribe now. Today I want to talk about pharmacy deserts. I am somewhat taken aback by the term pharmacy desert. The term desert means barren, without life. I am sure that you all know that Americans will coin words or phrases to describe a situation without explaining the term. For example, if you enter a place of employment, you hear various acronyms that will take you months to understand. Therefore, I want to use this blog to explain the concept of pharmacy desert. A pharmacy desert describes a place in the United States where residents have no access to local pharmacy or the resources of the local pharmacy. Other researchers have placed a measurement to define the concept of pharmacy deserts by highlighting that a pharmacy desert is a place where at least 1/3 of the population live more than 1 kilometer away from a pharmacy. But why do we have absence of pharmacies in these places in the United States? We already know that the marginalized communities have people with less spending power. Who wants to set up a business place in a community that has a low income population? Who wants to live in a community that will see high earners leave based on the arrival of low income earners? The reality is that these locations have been influenced by policies that can stretch right back to decades. In addition, who wants to invest in a place that has a low density population? Based on research, pharmacies continue to disappear. According to the Rural Policy Research Institute, 12% of pharmacies in rural areas closed in the United States between 2003 to 2013. One can just imagine the data now within our present context. While there are telepharmacies and mail order prescription, it should be noted that many people rely on pharmacies for over-the-counter medication. Personally, I do. For example, CVS in the United States and Fontana Pharmacy in Jamaica are my go-to places when I'm in these countries. According to the CDC, at least half the people in the United States take at least one prescription medication. Therefore, the need for access is essential. While I'm using this blog to talk about pharmacy deserts, I want us to recognize that these same places are sometimes underserved by primary care doctors and also have absence of healthy food choices. All these factors impact life expectancy. While there is a possibility of driving to another location, let us not forget that not all Americans have access to transportation. Oftentimes, these individuals also have mobility issues. The crisis of the pharmacy desert should not be underestimated. According to a PBS article, one man had to travel half an hour to access his required pharmacy branch to get his medication. I want us to be a bit critical. If pharmacies are going to be one of the pillars for the vaccination process, we have to understand that if these communities are already pharmacy deserts, then how will this flare out? The reality is the most vulnerable again could have limited access to get the required vaccination against COVID-19. I also find it heartrending to read that Black Americans are getting vaccinated at a lower rate than white Americans. Don't be too quick to highlight the unwillingness of Black Americans and Hispanic to take the vaccine as being one of the main factors of this lag behind. According to Scientific America, mistrust and access have led to this lag. Once again, the most vulnerable will be severely affected. While I have focused on pharmacy desert, the solution to this issue is made complicated based on the system of healthcare in the United States. When I lived in the UK, there was a pharmacy at every street. In Jamaica, I could hop on a taxi and be at a pharmacy in 5 minutes or drive to one. A pharmacy to me is a physical building where I can go in and fill my prescription and buy a few things over the counter. Therefore, if you cannot get a physical building up, I believe you could have mobilized healthcare in the form of pharmacy services on wheels. One such initiative was started by Walgreen in association with AARP and the National Urban League Way to Well tour. Having a nationalized service similar to the one mentioned could narrow down the health disparities within various communities. Thanks for viewing. Please remember to like, share, and subscribe to my channel. I will always try to bring you something that is out of the ordinary and something for you to critically reflect on. Thanks for joining me again.